So, welcome to day two of our conference. I'm Ruth Allen. I'm the Chief Executive of BASW. I know most of you, but maybe not absolutely everybody. It's absolutely delightful that you're here again. Most of you, I think, for the second day. We had a really, really good day yesterday, and thank you to everybody who contributed to making it so good, which was obviously the people who were speaking and holding workshops, but actually it's all of you. So thank you very much, and we hope to have another great day today. So a warm welcome to you in person here in the room, and also to our online audience. We had lots of online sessions happening yesterday, and that also went really well. So everything in this room today is streamed, so everything, the workshops and presentations in this room today are all streamed throughout the day. And people online can send in their questions or thoughts, and please do that. A little bit of housekeeping. I have to run through a few things like I did yesterday. Not expecting any fire alarms, so if you do hear a fire alarm, please exit by the nearest exits. The exits are marked there. Switching off any equipment that could become a fire risk as you go. Shutting doors behind you. We're not expecting any tests. There's Wi-Fi for delegates, to remind you. The information about that is on the registration stand. The network name is Delegates, and the password is Delegate with the first two E's as threes. So all that information is on the registration desk. Talking of registration, if you've come here and you haven't re-registered today, as in you haven't spoken to my colleagues at the registration desk, could you please do that? Because we just need to know numbers of people who are here. So when you go back up, just pop to the registration desk and just give them your name so that we can count you in and count you out again, I guess, something like that. So we are good to go, I think, for all of the housekeeping. We have the timings today are a little bit different to yesterday because we're starting earlier. So do check the timings of the workshops, and lunch is at 1 o'clock. There's a break in the morning. There's no break in the afternoon because we finish earlier. Please do stay to the end plenary if you can. And I just want to say a little bit about that. The end plenary will basically be a conversation with some of our contributors on the stage, but also a conversation with all of you about things that we've learnt and the priorities that we think we should be taking away, and saying a bit more about what BASW will be doing around sustainability, around both our themes, or our connected themes of eco-sustainability and sustainability of the profession and the workforce, and what we're going to do within BASW, but also what we're going to do within our profession in relation, and our responses to that. And they could be very diverse, and in a way that will be what was most interesting. So please, if you can stay to the end of the plenary today, that will finish, it'll finish 4:40 at the latest, and obviously it will be back in this room. So please do come to that. So we are now moving on to our morning session, and I'm absolutely delighted. You've got a cast of very esteemed colleagues from around the UK, and one of the great things that we love about these conferences is that we do have an opportunity to bring together people from across the UK who don't necessarily get that opportunity to talk about social work as it is experienced similarly and differently in the four nations. We also have representation from Europe, from continental Europe. We are European, actually, but anyway, from continental Europe. Anna Radulescu, who's the outgoing president of IFSW Europe, will be joining the panel. So thank you all in advance to all of our speakers, and we also have Trish McCulloch, who's joining us from Dundee University, who will be giving a keynote. So we hope this will also be a very interactive session, so we will be coming to you for questions and comments throughout the session. So I'd like to start by introducing our first speaker. Very warm welcome to BASW member and now ex-Chief Social Worker for Adults in England, Lyn Romeo.
Great. Well, it's a real privilege, actually, to have this opportunity to spend just a few minutes reflecting on social work from my perspective. And when I was preparing what I was going to say, I was thinking, gosh, it's 50 years ago that I went off to start my social work qualifying course. So 50 years, I know it's hard to believe, but I am that old. But what drew me into social work then, and I think it's still the same now if I was that young 18-year-old, was about wanting to make a difference, to be a change maker, to have those values of compassion, respect, empathy, to take a non-judgmental position, to have courage and humility, to value every single individual in our society, and to ensure we worked however we could to get alongside to protect their human rights and to pursue social justice for all. Now, a lot of those values came from my family, from being brought up in the particular religion I was brought up in, but from a very strong, connected Italian immigrant family living in a rural, the middle of nowhere in Australia, where often we felt marginalised and discriminated against. So having those opportunities for everyone to thrive and be the best they could be is what attracted me to social work. And interestingly, I was talking just the other day to somebody who was 50, who'd gone to Oxford and become a lawyer and done commercial law and taken time out to bring up her children and was wanting to go back to work, but wanting to do something that had meaning and purpose and where those values would be able to be applied. And she was interested in becoming a social worker and felt, well, what would she be the right person? And I said the most important thing is values, empathy, wanting to use relationship and strengths-based approaches in getting alongside of people to make a difference. So I guess social work for me is as amazing as it always has been, and it continues to be, and even more so given the very challenging contexts within which we all work. That mission to deliver social justice, equality, and to try and overcome the barriers that marginalise and disadvantage people in our communities. And the why and the what, therefore, of social work remains the same and constant. But of course, what changes constantly is the how and the where. And we know we've had to adapt and change and respond to different policies, different legislations, different structures, different guidance that comes out. But I think what's really helped us bridge that and deal with being part of the system, we work in the system, we have to, that's where we are, how we negotiate those pathways. I think the key value-added bit is how we absolutely try and get alongside and work together in partnership with the people we're here to serve and support, with practitioners who may be working on the front line right through to social work leaders and people who are responsible overall for the organisation delivering. So I think about the ways in which we apply our practice, and I get more prominence is given to that relational one-to-one strengths-based work, either with children and their families, or with older people, or with vulnerable adults, or adults in vulnerable circumstances. But yet there are many other ways in which our social work practice, our knowledge, our skills, our values, particularly the knowledge around the legal know-how of how to work in these complex contexts, help us. But the skills, those relationship, communication, empathy skills, that true kind of strengths-based approach, that works wherever you apply your particular approach. And that applies in group work approaches. There was fantastic stuff yesterday about intergenerational work and that more community work, community development approach. When I first came to work in this country, we had I know it's like rose-tinted glasses, isn't it? But we had a patch-based team covering a whole area. We covered from birth to death. We worked alongside nurses, GPs, schools, everyone. And we didn't have many resources in those days, where we really were using the professional use of self, our ability to work in those collaborative teams to make a real difference. And I think that is still the case. We sort of rise above what are the structural and systemic impediments that make it so frustrating sometimes, the lack of resources that are available. You have to fill this form in, or you have to tick that box, or you have to go and see so-and-so to make sure you can get some resources for whoever it is. It's very frustrating, and I know workloads and pressures on people are really extraordinary. But I also I've seen fantastic work to really focus on the well-being of our workforce, to try and improve approaches to workload management, to try and improve support and supervision, to have much more of a coaching, mentoring approach to how people and practitioners are supported, to involve people who draw on care and support, people with lived experience in shaping both planning, commissioning, and day-to-day practice of social workers. And I think in England, whilst everybody's a bit, oh, CQC are coming in now to look at what we do, in a way that's really had to sharpen that focus, because the whole movement, the Social Care Futures movement, led by people who draw on and rely on good social work, good quality social work, have shifted the narrative around this is about really listening and deeply to understand, not to assess, to know what matters, what's strong, how do we really work towards helping people to achieve the outcomes that matter to them, how do we create connected communities where we know there is a lot of goodwill and strengths and resources there, people just need the enablers and the right platforms to achieve them. So I have a lot of faith that for those of you in practice, for those of you who are researchers, and one of the things I'm really proud of is that we've made real strides in England around much more investment in research, building research skills, building the evidence around social work and social care and what works and what doesn't, trying to test things out and try things out and have a more iterative learning approach is making a real difference. And more specifically, more latterly, we've had great work that Jerry's done around social work with older people, which often really gets neglected and is invisible, and can often just be about, commissioning of care and support, whereas actually we know that relational social work practice with older people really does make a significant difference to them and what matters to them and how they cope with their lives and end-of-life issues. We've got fantastic palliative care, social workers doing fantastic work day in and day out. And I'm really impressed with some of the emerging models of practice that people have put into place. Restorative practice, strengths-based practice, family group conferencing, which also is happening in adult social care, making safeguarding personal approaches, which really try and strengthen that voice of the person and their network. So I am very confident, and having heard people speak yesterday, especially Omar and other people, I think I'm not really leaving the profession, but I know I'm leaving it in really good hands, and the kind of intelligence and thoughtfulness and creativity is fantastic. So I'm really pleased still to be a part of this profession. I think we've got to position ourselves, because government, even government now, is talking about strength-based community, connectedness, how we collaborate and work with citizens to make a real difference. So we are the leaders in that way of working with people. So I want to wish everybody all the best. So thank you very much.
Is this? Oh, yes, that is working. Lyn, thank you so much. You've been a real an inspiration, actually, to hold on to those values, doing a difficult job in government for 12 years, something like that. 10 and a half years, felt longer for you maybe. Anyway, Lyn has been very supportive, really supportive of BASW, is hugely supportive of the very best of good values and good practices, and has indeed, I think, taken our approaches to adult social work in particular forward really immensely, with the focus on strengths-based practice, on research-informed practice, on just encouraging new forms of social work leadership. So thank you for all of that, Lyn, and thank you for that opening. I think really describing the purpose and the values that help us sustain our profession for the long term and have sustained you. So thank you very much again for Lyn. Thank you. Lyn will be joining our panel in a bit, and also joining our panel will be our second speaker. But now to introduce Professor Trish McCulloch from Dundee University, who will introduce her talk and will be giving a keynote on the sustainability, issues to do with sustainability of our profession. Where are we going? What do we need to do? And the evidence that she's gathered in her own research. And we're delighted to have you with us this morning. So thank you, Trish.
Thank you for the invitation to be here. It's great to join you. It's very humbling, actually, to stand before you as a collected community, and that kind of notion of a kind of collective action and a collective attitude in our practice, to me, is well, it will hopefully kind of come through the sense of why it matters. But really what I want to bring today is simply some reflections from my particular sphere of social work practice, research and ideas. And my hope this morning is that they offer us points of connection and ways forward as we think about sustaining the workforce. Just worked out where the clicker is. That's a good start. Okay, in terms of just a quick overview, what I want to do is start by presenting some findings from research with early career social workers conducted in Scotland. And particularly, I want to look at early career social workers' accounts of practice as both strength and struggle, and their associated insights into what enables and constrains professional well-being in this space. So essentially, I'm going to be using this research to learn a little bit about what early career social workers in Scotland tell us sustains them in their work. But I also want to venture beyond the data, and I want us to think about ideas. I want us to think about ideas of practice and what social work practice actually means and where its strengths lie. And I want us to think about real utopias and the potential of both practice and utopia as sustaining logics. And I say that with some hesitation. It's why the opening says in defence of practice, research and ideas. Because a related argument here today is that we need to see these things as deeply connected, that our practice, our research and our ideas need to come together to sustain us as a profession. And sometimes the dividing lines that we construct between these things detract from our potential and our collective strength. Okay, so I'm going to speak quite briefly about the broad research because, as I say, I want to focus on one particular finding, but just really for you to have some context and hopefully to give a sense of validity. So we were trying to understand newly qualified social workers' experiences of practice over the first 5 years. So very much going beyond the kind of newly qualified social worker first year and trying to understand the social worker's development over their first 5 years. We used a mixed method study which involved annual online surveys, and there's some detail there about response rates, etc. So 34% response rate on average of the total population. Year 5, that dropped down to 19%. Year 5 was COVID, and all of the kind of intensity of online activity then. We also conducted repeat panel interviews with a cohort that started at 17 and continued through the 5 years with 13 people. So we have both quite a lot of quantitative, numerical data, but also very rich qualitative data. The research was funded by the Scottish Social Services Council, very much in a context of ambition and change for social services, and also associated with questions about professional readiness. On the right hand of the slide there are the areas that we looked at. So we looked at education, employment, experiences of supervision, perceptions of confidence and competence, etc. You can see it's there. I'm not going to get drawn into that because, as I say, I want to speak today about a very particular aspect and we just don't have time. Okay, so the key message, or a key message that came from the research was a notion of social work as both strength and struggle. And sometimes when you're conducting research, there's an expectation of, you know, how is it out there? Is it good? Is it bad? And we're kind of looking for this kind of positive, negative. Or we're looking to assess, are social workers ready? Are they competent? And actually what we found was they were both. I was tempted there to say neither one thing nor the other, but that's not true because actually what we found was that they were and felt very confident and competent in their role and in their remit and in their capacity to do that. And they felt unconfident and they struggled in the context in which they were working. So I'll hopefully be able to unpack that. So that was, and we were really interested in that finding because really what we were interested in is how do we support, and how do we sustain the workforce? And what do we need to learn from their experience in terms of how we do that? So in terms of where they were confident, competent, etc., one of the areas that social workers were most confident in was in their values. And even to an ability to practice in value-based ways. Social workers scored very highly in those areas. Yet, in the qualitative data, it was one of the areas they identified as their greatest struggle. And it's not even a finding I think I need to explain. I think most of you sitting in this room would understand why that is our greatest strength and our greatest struggle. Similarly, we found similar patterns when they spoke about working with other professionals, very confident in their ability and skills to do that, and particularly in increased interdisciplinary working, struggling with a sense of limited respect, limited efficacy. So both confident and competent in these areas, yet also struggling. And we found very similar patterns when we asked about personalised support. Again, the same kind of message. And I use these three things simply as examples. It was a theme that ran through our findings as we looked at how the workforce experienced practice. Caused us to kind of think about what did that mean. Were we kind of collecting contradictory data? Were social workers contradicting themselves? Were they overconfident in talking about who and what they were, and did that kind of confidence lag as they continued in their careers? Or were they constructing their best professional self? Was this about putting out a good image, a good story about social worker, but about what it was to be a social worker? But when we dug beneath that, did we hear a different story? And there's a little bit of these things in the kind of findings. Social workers were keen to celebrate who they were and what they were doing, and their stories of practice spoke to some of the struggle. But over these things, the key thing that we found was that experiences of practice in our kind of current climate was distinctly plural. It was both strength and struggle. It was also deeply situated. It was significantly influenced by the environments in which they lived and worked, by the relationships that they drew on. These things won't be surprising. They're coming through in lots of messages. And it's in process. It's not a case of qualified, a year in practice, I'm ready. Very clearly from the findings we saw that social workers were learning through the experiences they had in practice, that was part of their everyday, and that learning in practice was really significant for them. And so again, the environment and the relationships really matter, because they're both relationships and environments for practice, and they're relationships and environments for learning. Across the previous, one of the previous slides had those 8 themes that we looked at, from education, employment, etc. But we asked a closing question. We asked social workers to tell us about their experiences of being a social worker in Scotland today. And what we found in that closing question was that most provided a reflective account of that. 1 in 2 of social workers through years 1 to 5 provided this account of practice as a mix of strength and struggle. 1 in 3 described a mostly challenging experience, and I'm not looking closely at that today, but it's really significant that 1 in 3 reported a mostly negative experience, not enjoying social work, but describing a struggle. But I'm focusing on the 1 in 2, and at least 1 in 2. And that experience of practice endured over time. We saw only minor fluctuations through years 1 to 5. Okay, I want to unpick the idea of social work as strength. What made social work the kind of rich, rewarding, purposeful experience that Lyn was talking about? Essentially, social workers experience social work as strength when they experienced a pride, a passion, and a purpose in their work. When their work was worthwhile. So it was strongly associated with being able to engage with worthwhile work, the very things that Lyn spoke about, making a difference to people's quality of life, providing support, protection, and empowerment. And the important message is there is being able to work in that way was enabling for social workers. That was where they drew strength. It was associated with an alignment between their values and their practice when they were able to work in value-led ways. And that included working through conflict. So this strength is not an absence of conflict, it's not an absence of challenge, it's being able to do worthwhile work through conflict, through challenge. It was associated with nurturing and enabling relationships and environments. So for example, a supportive team and organisation, interprofessional respect and efficacy, and being part of a wider and healthy ecosystem. It was associated with being prepared for practice, and importantly, that wasn't just about post-education. That was a sense of the workplace and the organisation providing a sense of preparedness. It was associated with cultures of learning and development, so not being anxious about making mistakes, having a sense of being supported. And it was associated with a mix of the above. Social work as struggle. Again, often we heard these two things in the same account. Social work as struggle was associated with the challenging and stressful nature of the work, but critically, that wasn't, for most, a negative. When challenging and stressful work occurred in the context of a supportive environment, it was a site of learning, it was a site of worthwhile work, it was a site of making a difference. When it was enacted in difficult contexts and environments, it was associated with deep struggle. The accounts highlighted micro, meso, and macro challenges, as we would expect, but struggle was significantly associated with these meso and macro challenges. And really, I've just drawn from the bullet points below, just capture what came out repeatedly from narrative accounts. And I've got a slide with that. The next slide highlights some of these narrative accounts. Repeatedly, people spoke to the emphasis and the struggle of enduring budget cuts and the associated impacts on services, staffing level, caseloads, support, and the nature of the work. I don't have time to go into it today, but I think there's something more there than money. Budget cuts were real and they were a significant feature of people's experience, but it was such a pervasive environment and it communicated a lack of worth, which was problematic when you draw your value from worthwhile work. So there's aspects to unpack there. It was associated with low staffing levels and high caseloads, and therefore changing the nature of work, constant firefighting and crisis management, rather than the kind of balance. Social workers expected crisis, they expected some firefighting, but when the work moves to being mostly that, and not affording the kind of quality work that they wanted to do, it was associated mostly with struggle. Increased paperwork, administration, bureaucracy, again, these processes drawing people away from time with people. It was associated with poor workplace and organisational support, again linked to agile working, staff absence, and cultures of fear and blame. And what you should be seeing is they're really the converse of the strength factors in the slide below. And of course, following on there, a perceived lack of value and support from wider professionals, political and public sphere, and this sense of feeling unprepared. So real kind of consonance around what social workers identified as where they drew strength and what made them feel kind of strong and confident and sustained in practice and where they experienced struggle. And you know, when you look at the data, what you see is a kind of social workers giving voice to an enduring conflict. The conflict between social work's liberatory identity and mission, and its place within a broader neoliberal capital ideology. And my point here is not to see that as a negative, it's to understand that the nature of social work is to operate in spaces of conflict and spaces of struggle, which requires us, certainly as those who support the profession, to think about what does support look like in that space? How do you sustain a workforce who understands and is willing to take its place in that space, but need to be supported within it? I don't have too long to linger over there, but just some quotes that speak to what I've just said, and I'll allow you to read them if I can. The quotes are simply illustrative of the things that I've just said, that social workers draw strength from worthwhile work and the nature of the work, from a supportive team, these things which have been vital to me being able to do my job. And they struggle and battle with the emphasis on money, on budgets, on turning people away, on not being able to work in the ways that aligns with both their values and why they came into the profession. So in terms of addressing our question, what do we know about how to sustain the workforce? I would say that the findings from the 5-year longitudinal study, which align with several studies reporting and investigating similar areas, they highlight for me 3 key areas. And I guess kind of my question and my encouragement is for us to grapple together with how do we amplify social work strengths? And how do we mitigate and support through social work struggles? These are not new. They're not particular to this particular period of time. They may be amplified. But yeah, the question I guess I invite us to grapple with is how to amplify our strengths, how to understand and recognise and protect them, and how to mitigate and support the workforce through these struggles. And the three areas or pillars, if you like, are first and foremost worthwhile work. So those of us involved in social work, whether it's as practitioners, as managers, as professional bodies, as regulators, how do we protect worthwhile work? And I was having a conversation about thinking about regulation in the context of what are we regulating? Are we regulating that social work continues to be enabled and empowered to do this kind of value-based worthwhile work? It requires a close attention to empowering relationships and environments, or enabling relationships environments, enabling social workers to do the work that we need them to do as a society. And the third one is attention to social and political recognition and value. Social workers need to have a sense that what they're doing is understood and it has a value in the way that it plays its part alongside the contributions of other professions. So those are really the kind of 3 things I would suggest emerge very clearly from the data. I want really just in this final slide to move us, I suppose, into the realm of ideas. And I think for me what the research really speaks to is the importance of retrieving and protecting a sense of social work as practice. And when we talk about practice, I'm talking about practice as moral, social, and political action. I've referenced a paper by Michael Wan which speaks to that. It's titled On the Nature of Practice, and he describes practice as a form of practical moral engagement, and not primarily as a matter of technique, as a form of service to others enacted through daily encounters. And he goes on to say, implicit in the act of service, of helping the other, is some version of the good. I think what I'm saying here is I'm reminding us of what social work is, and the importance of being able to hold to and protect that notion of social work as moral, social, and political practice. And there's some other references there, including the definition of social work by IFSW. The second part, and I'm moving through this quickly because I really need to draw this to a close, but the second part is the idea of a vision of the good, a utopian vision, and that's where I started, this notion. And I'm drawing here significantly on a paper by John Friedman, and the paper's entitled Imagining the Good City, in Defense of Utopian Thinking. And I'm not sure where you sit when I say utopian thinking, because when I first came across it, I don't know, as a social worker, there's maybe something that just doesn't quite align. It felt at the time fanciful. It felt fairy tale-like. And it took me some time to kind of unpick what it offered us. And I suppose I'd highlight, there are two key moments. Researchers on utopian thinking identify two key moments: critique and constructive vision. And to my mind, there are a lot of parallels there with what we're talking about here, about notions of sustainable futures. It's both a critique of what is and a recognition that things need to be better, and it's envisioning something better for the future. So I guess I kind of invite you to think about this notion of utopia within the debates around sustainability, because I think they invite us to envision and enact the good city, drawing us back to the heart of what social work is and is for. Okay, I'm going to close there. There's a song I'd like to just play as we move into the plenary. And it's a song that was written in Castle Huntly, just across the field from where I live. It was co-written and produced by Vox Liminis, which is an organisation which works with people involved in the justice system. And I'm sharing it for two reasons. It speaks to the kind of practice that we're talking about this morning and that we're talking about today. But it also speaks to the ways that we sustain each other. And this is a prisoner telling the story of what sustains him and gives him hope for the future. I think...
Keep my head afloat when all I want is to sink. You always keep me smiling with your constant wit. Turquoise eyes, chocolate hair, passion cherries under there. Since we've been together, we just seem to fit. I'm content and I'm happiest with you. I feel confident, I feel brave, it's true. You're my wife, you're my all, you're my something wonderful. It feels right when you hold me like you do. Breathe life into me. You breathe life into me. You're my wife, you're my all, you're my something wonderful. You breathe life into me. Dancer, your partner, your lover, and step by step we'll circle the fire, and the heat from the flame steals the air from my lungs. But you breathe life into me. Breathe life into me. You breathe life into me. Turquoise eyes, chocolate hair, passion cherries under there. You breathe life into me. You breathe life into me.
That was a very beautiful, inspiring piece of music and song. about what sustains somebody, and it just made me reflect on whatever sustains us. Is to take the time to reflect on that. So we had a little pause there, and that's no bad thing. And thank you, Trisha. That was a fantastic talk, very inspiring. And we're going to talk about those ideas now. I think it would be nice if we just maybe take a couple of comments or questions, if there are, from the audience, just to kind of engage people. So if anybody has anything they'd particularly like to come forward with on that. I'll come to you, VJ.
I'll shout. For you, Trish, is that in the workforce, did you think about gender, age, ethnicity, and are there changes around that come through?
I'm just going to pick up on that for our... the issues for age, ethnicity, the diversity of the workforce. Did any of that come through in what you were finding? Can I just... You're mic'd up, that's okay.
The simple answer is we've not got to that yet. One of the challenges was 5 years of data, and really we were trying to understand patterns across the 5 years. But we do have basic level data there to have a look at. So unfortunately, we've not got to that yet, but it's an important question. Yeah, I'm not going to say any more on that and complicate it. Thank you. Another question here.
I'm very loud, so I might not even need this, but that was brilliant. I've just left Callie under Martin Kettle, who I believe helped with that. Amazing research. I'm just curious if anything has come through. BASW have recently done some research with newly qualifieds, and a lot of newly qualifieds aren't receiving statutory placements, and actually are getting 2 years of third sector and aren't feeling prepared. So I noticed there was the comment about feeling underprepared for actual practice. I wonder if there was anything that had come through in a positive way from that, like was students actually feeling prepared, or is it all still a bit doom and gloom?
Yeah.
Sorry, that's a doom and gloom question.
No, it's so one of the so many aspects of the research that I couldn't even get close to today. But another key message that came across was that actually early career social workers in Scotland reported a very mixed experience, and it relates to some of the things. So some people spoke about their qualifying experience as wonderful, and they felt prepared and they felt supported, and almost always practice placements featured in that, and statutory practice placements featured in that. And I'm absolutely clear of the value of statutory and voluntary third sector, and our research speaks to that and both. The challenge was experiences were very different, and as you say, some people didn't have any statutory experience, and mostly they felt unprepared when they went into practice. And so, yeah, there's the diversity of experience and our inability to provide a more consistent experience for all social workers in the preparation is challenging. But really what it also spoke to, which is so important for us, was the significance of academic and practice learning together. That's what the research spoke to. And that continuing. So for me, it is absolutely about how do we continue to build and strengthen the partnerships where there's lots of reasons for them to fall apart.
Thank you.